Another area that is common in terms of neglect and abuse in a nursing home are medication errors. That is, giving the wrong medication to a patient, giving the wrong dose to a patient, and that shows up in the ability of a patient to think, the ability of a patient to function, and it can send a physician down the wrong path in diagnosing why the patient is acting that way. And we'll talk a little bit about some of the other rights that a resident has, but keep in mind that medication errors are pervasive in nursing homes and lead to neglect and abuse.
Do you think that facilities ever intentionally sedate patients?
Unfortunately, there are situations, and it's not necessarily uncommon, because they don't have enough staff to take care of residents. What they really need are more nurses, more hands-on, and if they do that, it's at the expense of the resident, and it can be life-threatening.
They have to document a need for the medication, the lowest dose possible, the result of the medication, whether or not it's working for the intended purpose, and then reevaluate periodically if that medication is still necessary, because it may be required for a brief period of time in the patient's medical condition, but then he or she may, the next week not need it, and it's actually dangerous to continue giving it to them at that point.
Medication is never to be used for a purpose other than the medical needs of the resident. It's never to be used for the convenience of the nursing staff. And that's called chemical restraint.